Good afternoon, everyone. On behalf of Screen and J and the Rutgers Center for Tobacco Studies, thank you for joining us on today's call. My name is Nicolette Garth. I'm a research teaching specialist at the Rutgers Center for Tobacco Studies, and I'll be your moderator for today's presentation. Today, Heather Jordan is going to lead us through making the quick connection for lung cancer screening sites, a presentation on information about the health risks associated with tobacco use, the benefits of quitting, the free cessation resources in New Jersey, and opportunities to connect lung cancer screening patients to tobacco treatment. We'll reserve 15 minutes for Q&A at the end, so please insert any questions you have throughout the duration of this talk into the chat box. And we also invite you to please introduce yourself right into the chat. Share your name and the New Jersey county you work in, as that will be relevant as we start talking about the quit services. Just a few housekeeping items and technical notes before we start. Make sure your microphone is on mute during the presentation. During Q&A, there will be an opportunity for you to turn it back on if you would like. We will also be recording today's presentation. So you will have received a little message as you logged into the Zoom, and we'll share all materials after the webinar is finished. It's now my pleasure to introduce our presenter today. Heather Jordan is a research program manager and health educator at the Rutgers Center for Tobacco Studies. Ms. Jordan is a lung cancer screening and tobacco cessation health educator for Screen and J as well. She holds a master's degree in public health with a concentration in maternal and child health. Ms. Jordan is certified in public health, a master health education specialist, and is trained as a tobacco treatment specialist through the Rutgers Tobacco Dependence Program. And without further ado, I'd like to hand the presentation over to Heather.
Thank you very much, Nicolette. I am wearing my headphones, my headset today. So if somebody out there could just do a thumbs up, let me know that you can hear me just fine. Volume's good. Excellent. Thanks, Nicolette. All right, let's go to the next slide. All right, so we have this wonderful technology at our disposal. So we are going to do a couple of fun Slidos for the group on the call today. So you can take your smartphone and you can point your camera at that QR code and a website's going to pop up for you to join Slido. You can also do that through a web browser as well, going to slido.com, and you can see the number there is 830-878 for you to join our Slido. And our first question that's going to be launched is a poll, and it is, what is your current professional role? So if folks could point their cameras at that QR code, log on in and type in your current professional role. I'm not going to try this time because I don't want to use too much technology at one time, but somebody out there, give it a try, type in your current professional role. And we're going to see a word cloud start to appear with your roles. So I see Oncology Nurse Navigator just popped up. Excellent. Excellent. So we've got some varying professional role job titles. I see Lung Navigator, Medical Assistant. We have a few Oncology Nurse Navigators, clearly, because the larger the word, the more of you that are on the line. So we have a few Medical Assistants, a few Oncology Nurse Navigators, Certified Medical Assistant, Lung Navigator, physicians on the line, which is fabulous, Public Health Researcher. So you can see we have a lot of different health professional roles, and those of us that are in this field of lung cancer screening and tobacco cessation. So we'll give it just one more moment because I see a few more popping in. Excellent. So we have a lung cancer screening educator, RN, on the line, which is fabulous. Clinical care coordinator, important. Patient navigators, oncology nurse navigators, wonderful. We welcome all of you here today in your various roles. And despite your role, the differences in your roles, we all do have a role to play in identifying individuals eligible for lung cancer screening, getting them into the LDCT equipment, and also for those that are current tobacco users, getting them information about tobacco cessation, which is why you're here today. So I think we'll go ahead and close that poll and we'll move on to our next slide. Thank you very much, Nicolette. All right, so I'm going to get started with this talk now. And for those of you on the line, some of this information is probably not new news, but we do like to review these details just to make sure we're all grounded in similar information right now in this moment. So this slide shows you the health consequences of cigarette smoking. And you can see there are about 7 million deaths due to smoking every year worldwide. And then in the United States, it's about 480,000 deaths that are due to smoking. So that's 1 in 5 deaths in the United States due to smoking each year. You can see that smoking contributes more deaths per year than HIV, illegal drug use, alcohol use, motor vehicle accidents, and firearm-related incidents combined in the United States. So when we think about that 480,000 deaths per year due to smoking, you can see the chart on the right that gives you a breakdown of those 480,000 deaths. You can see lung cancers, it's approaching about a third, heart disease is a third, COPD is about a fifth, and then there are other things as well. There are diagnoses, cancers, and stroke as well. Next slide, Nicolette. We know that tobacco use is the single most preventable cause of disease, disability, and death in the United States. We show this graphic on the right to show you that even though we might be thinking about tobacco use, cigarette smoking from our lips and nose into our lungs and back up again, sure, those areas of our bodies would be impacted by tobacco use, but there are certainly many other parts of the body that are affected by tobacco, cigarette smoking. You can see here, cancers listed on the left, and chronic diseases listed on the right. And you can see every organ in the body is affected by tobacco use. So when we're talking with patients and clients about their personal health history, it's pretty easy to relate anything somebody might be dealing with in their personal health profile with their cigarette smoking. So we might say to somebody who's a diabetic, you know, the cigarette smoking you're doing might have something to do with your diabetes. Perhaps if you quit smoking, we can manage your disease better. Things like that. Next slide, Nicolette. Here's another graphic for the health consequences of cigarette smoking, and this is about cancers. So again, like I said previously, many times we think about from our lips and nose down to our lungs and back up again. Of course, those areas of our bodies will be affected by the cigarette smoking, but there are other cancers in our bodies that happen because of cigarette smoking. You can see here pancreatic cancer, stomach cancer, liver cancers, for example. We know, though, that in the United States, 1 of every 3 cancer deaths is linked to smoking. So it's a really important thing for us to be thinking about. 1 in 3 cancer deaths is linked to smoking cigarettes. Next slide, Nicolette. So let's talk about smoking and lung cancer. Smokers are 25 times more likely to develop lung cancer compared to people who never smoked. And we know that smoking causes between 80 and 90% of all lung cancers in the United States. We also know that smokers today are at greater risk of developing lung cancers due to a couple of things. We know over time that cigarettes, the design has changed. So things like filters and vent holes. With the addition of filters and vent holes, we would think that the cigarette sticks would actually be less harmful. But what happened was smokers were breathing deeper with every puff on that cigarette stick. So when you breathe deeper, take that deeper inhalation and hold it in your lungs, you're actually doing more damage to your lungs than when the filters and vent holes weren't there because you're holding it deeper. We also know that the cigarettes just have there's a changing chemical composition over time. The cigarette companies have changed what goes in to the cigarette sticks, and they're just more carcinogenic now than they were in the past. For those of you that are more visual and think about this from like a picture graphic perspective, when we talk about the relative risk of lung cancer for smokers compared to people who never smoked, this graphic shows that relative risk for you. So the non-smokers are in gold. You can see those very small bars for the relative risk for non-smokers. And then male smokers are light gray and female smokers are dark gray. So you can see the relative risk for male and female smokers is much greater compared to the non-smokers, those gold bars. You can also see over time that male smokers had a greater relative risk of developing lung cancer compared to female smokers. But over time, you can see the relative risk for males and females is now about the same. So for some people, they might think, well, women don't get lung cancer, we're fine. Men are the ones that get lung cancer due to smoking. Well, the data says something different. Men and women have about the same relative risk in developing lung cancer if they're smokers. Next slide, please, Nicolette. There are certainly other causes of risks and causes for lung cancer. So yes, cigarette smoking causes between 80 and 90% of lung cancers, but we do provide a list of other causes as well. So for example, exposure to radon is the second leading cause of lung cancer in the United States, and it causes about 20,000 cases annually. We also know exposure to secondhand smoke and exposure to other substances, including workplace exposures, also causes lung cancer. Having a family history of lung cancer is also a risk for developing your own lung cancer as well. Next slide, please, Nicolette. Let's talk about radon for a moment. Radon exposure causes about 20,000 lung cancer deaths each year. And unfortunately, radon is that gas that occurs naturally in the ground, and it gets trapped in houses and buildings and comes up through basements, and it can't be seen or smelled. Unfortunately, we think that about 1 out of every 15 homes may have high levels of radon. The good news is that homeowners can test their homes or hire a company to come out and test their homes for radon exposure. And for more information, I give you the New Jersey DEP phone number and website. So if anybody has more questions about radon exposure, you can certainly go to that website and learn more. Next slide, please. So what's inside that cigarette stick? What makes it carcinogenic? Well, this is a graphic that is used a lot in the quit centers to show cigarette smokers what they are breathing in with each drag on their cigarette stick. There are approximately 600 ingredients in a cigarette, and when it's burned or combusted, used as intended, cigarettes create more than 7,000 chemicals, and at least 70 of these are known to cause cancer. Importantly, the nicotine found within the tobacco products is what makes them addictive, but it does not cause the cancer. So this graphic is used, and sometimes we personalize messages. So if somebody talks about, flipping their butane lighter, I say to them, well, that butane is inside your cigarette stick. Another example not on this graphic is acetone. For folks who wear nail polish, we can say to them, that nail polish remover we use, that's inside of your cigarette stick, and you're breathing that in every time you take a puff on your cigarette. Next slide, Nicolette. Let's talk about nicotine. It is the addictive substance found in the tobacco products, including e-cigarettes. It enters the bloodstream and reaches the brain very quickly, and that causes the chemical release of what's called dopamine. And dopamine is that pleasurable effect that is associated with tobacco use. After someone's done smoking a cigarette, that dopamine is in their body, it's causing that pleasurable effect, but after a little bit of time, things start to change inside the brain, and the dopamine goes away, basically, and people feel what's a craving, and they want to take another drag on the cigarette stick to get more dopamine to be released in their bodies. Next slide, please. So why should someone quit smoking? There's lots of reasons. And a lot of times the tobacco treatment specialists and those on the quit line will try to personalize messages to tobacco users. We might talk about health effects of quitting smoking. So quitting smoking is the single most important step a smoker can take to improve both the length and quality of their life. And even those who quit smoking later in life will have numerous health benefits from that quit. Sometimes we talk about finances, sometimes money talks. So let's say a pack of smokes costs $10. So someone's spending $10 a day on cigarettes. So we can do the math with them, and it comes out to about $2,000 every year spent on buying packs of cigarettes. Sometimes that money does talk. Sometimes that's enough to make someone think about making a quit attempt. Other times, we talk about family and friends. It could be that a cigarette user doesn't really care so much about their own personal health and safety, but they have grandchildren and they don't want to smoke around their grandchildren. So a personalized message around quitting smoking to protect the health of grandchildren might be something the tobacco treatment specialists talk about with the tobacco user. Next slide, please. And we certainly want to talk about quality of life issues. We know, for example, smoking can reduce the sense of taste and smell. And so if we have a tobacco user who really enjoys going out to dinner, we can personalize messages and say, you know what, if you quit using your tobacco products, you might actually be able to taste and smell that food you love so much even better. There's also other things that we can talk about for quality of health, quality of life as well, and we certainly personalize those messages. Next slide, Nicolette. Quitting smoking greatly reduces the risk of lung cancer and other health consequences. And it's never too late to quit smoking. We talk about that with tobacco users all the time. Somebody might be 65 or 70 years old. It's never too late for them to make a quit attempt and improve the quality of their life. So for example, you can look at this graphic here, and I won't go through each one, but you can see even 20 minutes after your last cigarette, heart rate and blood pressure drop to a more normal level. So the body can just function more efficiently. It can do its job. About half a day after quitting, carbon monoxide levels return to normal. So when a cigarette smoker is breathing in all that smoke, they're breathing in carbon monoxide, not oxygen. Our body needs oxygen to function. So if we're not breathing in the carbon monoxide, we can breathe in oxygen and our bodies can work more efficiently. And then you can see over time, 2 weeks later, a month later, a year later, the health effects, the benefits of quitting smoking. You can see 5 years later, after a quit attempt, the risk of a stroke decreases to that of a non-smoker. It's never too late to quit smoking. And so luckily in New Jersey, there are plenty of resources available to help tobacco users quit their tobacco product use. And the services I'm going to talk about are evidence-based to deliver these services. So that means that lots of research has been done around the best methods to try to help tobacco users quit their products. And we have people at the quit centers, at Quitline, and other resources using that evidence to provide the best, the latest and greatest to tobacco users to help them make the best quit attempt they can make. Next slide, Nicolette. So before we go any further, we're going to do another Slido. We're going to break this up. So I'm going to ask you to go ahead and point your phones at that QR code again, and a website's going to pop up, and it's going to ask, what is the AAR Brief Intervention Model? What does AAR stand for? Is it Ask, Assess, Review, Ask, Advise, Refer, Advise, Assist, Review, Assess, Assist, Refer? Ooh, that's a tricky one, and it was a tongue twister as well. So I'm going to ask folks out there on the line, point your phones, if you can, to that QR code, and the website will pop up, and I'll ask you to answer that question. If you don't have a smartphone, you can type in slido.com and then type in that number, and you'll see that poll question. So we're going to give folks a few moments, and Nicolette, you're monitoring on your end, so you can see when the answers are coming in. I cannot. So I'm going to wait for you to advance this so we can see what the answers are out there. So again, what is the AAR Brief Intervention Model? Ask, Assess, Review, Ask, Advise, Refer, Advise, Assist, Review, Assess, Assist, Refer. Woo. AAR. I'm going to go ahead. I actually pointed my phone at that QR code and it worked. So I'm going to answer the question to the best of my knowledge. And I just
We're
sent
going
it
to
in.
give 20 more seconds. I see about 13 responses have come through. So 20 more seconds, everybody.
All right. You can do it. It's anonymous. No one will know what your answer is. It's just going to pop up in a little chart for us, hopefully. What is the AAR Brief Intervention Model? Excellent. Okay, so I see Ask, Advise, Refer. More than half of you said Ask, Advise, Refer. We have a couple questions or answers coming in. All right, I think we should lock this down. So I'm happy to report that the answer is Ask, Advise, Refer. So that is one of the brief intervention models that we can use when we are working together to refer patients to tobacco treatment. So evidence-based clinical practice guidelines. This is the evidence I was talking about before. So this document, this is the cover of a booklet. I actually have this book on my bookshelf in my office with lots of sticky notes all sticking out of it all over the place because it gives great guidelines on ways that we can treat tobacco use and dependence. Here are some important takeaway messages from that document. Tobacco dependence is a chronic disease. Every patient who uses tobacco should be offered treatment. Clinicians and systems should identify and intervene with all tobacco users. And brief interventions such as ask, advise, refer have an effect. And the 5A's model, which I'll talk about as well, is encouraged. Also, there is a strong dose-response relationship between the intensity of tobacco dependence counseling and its effectiveness. So effectiveness increases with treatment intensity. The more minutes of contact, the more times a tobacco user sees a counselor and talks about this quit attempt, the more likely they are to have an effective quit attempt. Next slide, please, Nicolette. Here's a bit more from that clinical practice guidelines document booklet. Individual, group, and telephone counseling are effective. 3 types of counseling and behavioral therapies were found to be especially effective. So practical counseling, like problem solving and skills training. The provision of social support as part of treatment, so group and having a social network while you're making a quit connection all together in group, and then help in securing social support outside of treatment. So what's happening when you're not coming to group? What's happening at home, let's say, with your spouse, significant other, or workplace friends that could help you with your quit attempt? Creating that social support is important. Also, the clinical practice guidelines talk about the FDA-approved medications and that they are effective in assisting with a quit attempt. Counseling plus medication is more effective than either is alone, and this combination should be encouraged for all patients willing to make a quit attempt. We also know that tobacco dependence treatment is very cost effective relative to other common medical treatments, and it should be covered by insurance plans. So we know, for example, that Medicaid can cover the stop smoking medications that are available, including NRTs. Next slide, Nicolette. So here are the 5A's. Ask, advise, assess, assist, arrange. And here's a quick way that you can do these 5A's in the sites that you're working in. If it's a lung cancer screening facility or a community-based partner that we're partnered with through ScreenNJ. So for ask, you're going to ask about current tobacco use for every client or patient. Yes or no? If no, provide a message about prevention. Not ever starting tobacco use is the way to go. We don't want you to ever start using tobacco products, or if they recently quit, we want to talk with them about any challenges or the confidence they have in remaining abstinent. We don't want them to relapse. If you ask somebody if they are a current tobacco user and they say yes, then you bump down to the next level. You advise them to quit. Quitting smoking is the number one thing they can do to improve the quality of their life. And then we assess if they're willing to make a quit attempt at that time. If no, you could give them some brief motivational interviewing messaging, right? You can say, quitting smoking is a really important thing. You might want to consider looking up some information online about why it's important to quit smoking. Or you might want to talk to somebody about, if using one of those medications like the patch might be helpful for you. Just get a little bit more information. But we're not pushing them into making a quit attempt at that time. But if we assess and they say yes, then we bump down to the next level. And they say, yes, I am willing to make a quit attempt. Then we're going to try to assist them with their quit attempt. So during assist, we talk more about what their triggers might be, things that they might need to do to be able to be successful in that quit attempt. We might talk about medications like the patches, Chantix, and bupropion. And also we want to refer them to additional resources. Then after we do assist, we bump down to arrange and we create an opportunity for a follow-up appointment, maybe in person or by telephone. So those are the 5A's: ask, advise, assess, assist, and arrange. Next slide, Nicolette. Now here are 2A's and an R. It's brief. It's the 5A's, but condensed. It's ask, advise, refer. So in ask, we're going to ask, have you ever smoked or used any form of tobacco in the past month? If they say yes, we're going to advise them the best thing you can do for your health is to quit tobacco use. Are you planning to quit in the next month? And if they say yes, you can provide a referral to Quitline, Moms Quit Connects, or the Quit Centers. You might even start a discussion about the medications, but the important part is if you've asked and advised to refer them for additional opportunities for service, for quitting smoking and tobacco products. If they say, no, they haven't smoked in the past month, there are additional steps you can take, right? You can ask them, well, have you ever smoked or used tobacco products? If they say yes, congratulate them on that quit attempt. Even if they said they quit 10 years ago, it's always important to congratulate somebody on making a quit attempt. If they say, nope, I've never smoked or used tobacco products before, you still want to congratulate them. Good job. That's really great. You're taking care of your health. Next slide, Nicolette. I give you the resource here for the CDC Pocket Card. It is, in fact, what it's called. It's a pocket card. You can print this from, if you go to that website there that it lists there on the left-hand side. So this shows you the 2 A's and an R and the 5 A's intervention model. So you don't have to memorize these things. They're right here in this document for you to download. You can also see that some national resources are also available on that pocket guide as well. So for example, the 800 Quit Now national quit line is available there on the card. Next slide, Nicolette. Some of our quit centers have worked with their partners to create examples of scripting for 2 A's and an R. So I show you this as an example. The Institute for Prevention and Recovery has shared this out to us. They are one of our funded quit centers in New Jersey, and they developed this tool, for example, for the Somerset Oncology Group. So this is Ask, Advise, Refer, and it can be done in 3 minutes or less. So it's a very quick and easy thing to do with each of your clients or patients. So ask, again, you're going to ask the screening questions and document in the EMR if they're a nicotine or tobacco user. If no, there's no action required. If yes, you go to advise. And then there's some scripting here. So you don't even have to memorize the words I was saying earlier. It's right here on the script for you to use. So you're advising and then you're referring. So this particular script is advising and referring patients over to the Institute for Prevention and Recovery Quit Center. So we can certainly share this script out with any partners on the call for you to develop your own scripting internal to your organization that you work with. Next slide, Nicolette. A lot of times when we give this talk, individuals on the line want to learn more about the FDA-approved tobacco cessation medications. I realize you probably cannot read this graphic because there's an awful lot of information. It is a one-page document. We can provide this to everybody on the call via an email. It will be a PDF document. And you can see here, unfortunately, you can't really see very well, but you see Zyban, well, Butrem bupropion is on the top row, Chantix, and then there are the 5 NRTs that are available for using during quit attempt as well. So the patch, gum, lozenge, nicotine inhaler, and the nicotine nasal spray. So this graphic does provide usage instructions, advantages and disadvantages, some side effects, and some costing information as well. We also do provide some precautions just to be sure that everybody on the line understands these medications and that they are used as intended for the populations that would benefit the most. So if folks do want this document, please email myself or Nicolette and we can get this document over to you. And if folks have particular questions about these medications and personal health histories for patients, Michael Steinberg is the medical director for the Tobacco Dependence Program Center for Tobacco Studies, and he is available to answer any specific questions you have about these medications. Next slide, please, Nicolette. So why are we all on the line today? We want to make sure that we are linking tobacco treatment to lung cancer screening. It's really important to make the connection between lung cancer and tobacco treatment. A key component of the lung cancer screening shared decision-making encounter is a very strong statement of encouragement for the patient to remain smoke-free or to quit their tobacco products. So we know if somebody is coming for lung cancer screening, they're going to be hearing about how they should be quitting their tobacco products if they're using them now, or that they should remain abstinent from tobacco products. We know that when tobacco using patients arrive at a lung cancer screening site for their LDCT, they are highly motivated to quit. They might not appear it to you, they might look scared or maybe even apathetic about it, but we know that they are highly motivated to quit. So it's an opportunity for lung cancer screening facilities to link those patients or clients, to refer them quickly to some kind of local tobacco treatment program. And we know that lung cancer screening facilities are they can link with tobacco treatment programs, and those links can be established because we have examples of that happening in New Jersey every day. Next slide, please, Nicolette. So again, tobacco users at lung cancer screening are highly motivated to quit. And we believe that referral to cessation treatment should be offered to all tobacco using patients, even those that are not immediately ready to quit. Just providing a little bit of information, maybe a phone number, maybe a flyer, is sufficient to maybe have them start thinking through the idea of making a quit attempt. We know that these patients will have contacts with different clinicians who can reinforce, even briefly, the importance of tobacco treatment and where to find help. We also know this group needs intensive, comprehensive tobacco treatment because they're likely highly dependent on nicotine. If they're coming in for lung cancer screening and LDCT and still using tobacco products, they probably really need that nicotine for that dopamine release to happen. And they're very, very highly dependent and likely would benefit from medications and counseling in tandem to make a quit attempt. Also, importantly, we know that when folks come to tobacco treatment, let's say to the quit centers, if they are eligible for lung cancer screening, they will be likely to want to potentially hear about lung cancer screening. We know a significant portion of them that reach out and receive the tobacco services in New Jersey are eligible for lung cancer screening. And so we have trained up the tobacco treatment specialists that are at the quit centers in particular to determine if someone is eligible for lung cancer screening, to potentially provide a little bit of information, and to refer them back to their primary care doctor to learn more about lung cancer screening. So we are trying to create loops back and forth between tobacco treatment and lung cancer screening. Next slide, please, Nicolette. So let's talk a bit about the tobacco cessation services that are available here in New Jersey. We have quit centers, we have Quitline, we have the Rutgers Center for Tobacco Studies Tobacco Dependence Program, we have Quit for Kids, and we have Moms Quit Connection. We also know that there are other tobacco cessation programs embedded within local health systems as well, and those are important services for New Jerseyans. Next slide, please, Nicolette. So here's some information about the NJ Quitline, 1-866-NJ-STOPS. This is a free telephone-based counseling service for New Jerseyans who are 18 years of age and older. Individuals can call this line to register, or they can even register online, and then a quit coach will call them back. Once someone is registered into this program, they can receive emails and tips through their quit process, and they can also request free NRT patches. So here is the website, www.njquitline.org, to learn more information about the Quitline. Next slide, please. Importantly, for those of you on the line, NJ Quitline has a smoking cessation provider toolkit available. So you can go ahead and go onto their website, and you can download that free provider toolkit by just filling in a few pieces of information about yourself and the place that you work. And then somebody on the team there at NJ Quitline will go ahead and forward you information. That group that is running the Quitline at New Jersey also can provide training on 2 A's and an R, which is Ask, Advise, Refer, and they can customize a fax or email referral form for providers to use with their clients. So this would be, you have identified a tobacco user, you would advise them that they should make a quit attempt, and then you're referring them, in this case, to New Jersey Quitline via a customized fax or email referral form that's available to you, that team over there at NJ Quitline will develop for you and get to you to use. Next slide, please, Nicolette. Moms Quit Connection for Families, Quit for Kids is also a telephone counseling service. This one is dedicated to families with children under the age of 7. So messaging is directed more around family health, right? The exposures that a tobacco user might be subjecting children under the age of 7 to. They also have a Quit for Kids texting support program. And here is the phone number for Moms Quit Connection for Families and Quit for Kids. It's 1-888-545-5191. And you can receive more information about this service by going to www.quitforkids.com. And just for everybody on the line's purposes, we will be forwarding out this slide deck to everybody on the line. And when you open the slide deck, all of these links here are hyperlinked. So it's an easy point and click for you to get to where you want to be after you receive this slide deck. Next slide, please, Nicolette. So also interested individuals, if they don't feel comfortable making that phone call first, they can also register for Moms Quit Connection for Families and Quit for Kids through momsquit.com. So this would be a tobacco user who would be eligible for this service, would fill in just those few bits of information, and this information remains confidential. No one's going to see any of this information except for the coaches on the other end receiving this, so they can make the phone calls to call these individuals and enroll them in the service. Next slide, please, Nicolette. And now let's talk about our quit centers that are available here in New Jersey. The quit centers are staffed with tobacco treatment specialists. Importantly, they are available to talk for up to an hour with each client to do what's called a new patient assessment. And then they provide a comprehensive individualized treatment plan with each client. So they have the time to talk through an awful lot of things about the tobacco user's history, their triggers, the things they want to accomplish in their quit attempt. They can talk through medications and also talk with them about the group and individual counseling that's available at those quit centers. Importantly, at the quit centers, they do provide free individual and group counseling sessions. And those sessions are currently offered via phone and video conference. And some of the quit centers have started going back to in-person group sessions and one-on-one sessions as restrictions are lifted within their health systems and other organizations they work within. So tobacco users should call up those quit centers to see if in-person is available at this time, but they are all able to do phone and video conferencing to assist the clients with their quit attempts. The quit centers also can provide free nicotine replacement therapy to get their clients started with their quit attempt. And they, like I said previously, do have information and materials about lung cancer screening available to give to their clients. Readmission into the quit centers is certainly possible. So if somebody tries to quit tobacco use and is not successful, they can always come back and restart their quit. No one is turned away. We want people to come back and make an additional quit attempt until they're successful in quitting tobacco products. So more information about the quit centers can be found at www.tobaccofreenj.com/quit-smoking. Next slide, Nicolette. So New Jersey residents are invited to call the quit center closest to where they live or work to discuss the available services at that quit center and to set up a free new patient assessment. You can see here, this is the flyer that is available about the tobacco cessation options in New Jersey. There's a handy dandy QR code on that flyer. So folks who are feeling savvy could actually probably try to point their phones at that QR code right now, and you would be brought to that Tobacco Free NJ website. Importantly about our map of New Jersey is this: we know there are not pin drops in every single county in New Jersey. A physical quit center may not be located in each county, but a happy circumstance of the COVID pandemic is that our quit centers did go virtual. So now they can provide quit services to anybody in any county in the state of New Jersey. So if you don't see a pin drop in your county, that's okay. Just identify the one closest to you and give a call to that quit center to try to establish a relationship between your organization and the quit center that you called. We can certainly make that happen. Next slide, please, Nicolette. So here is more information about those quit centers. This slide is information to you to build connections with the quit centers and your sites. This is not exactly patient-facing information. So you can see we list out the counties that the quit centers service. If your site is in Burlington, Camden, Hunterdon, Morris, Sussex, or Warren counties, you can certainly call the quit center closest to you, or we invite you to contact Michelle Kennedy, who is leading the charge and the technical assistance to all the quit centers, and she can connect you with the quit center that makes the most sense for your site. You can see Monica Hanna at the Institute for Prevention and Recovery, Donald Noblet down at Inspira, and then we've got Natalia Allen up at Hackensack, and Allie in Atlantic, and we have Nikki and Kate May. So those are our 5 program leads and at most of the quit centers around the state. And we invite you to contact them via their email addresses. If you want someone like myself or Nicolette to make that connection for you, make an e-introduction, we are certainly happy to do that as well. So if you want to send myself or Nicolette an email and tell us you're ready to try to build a relationship with a quit center, a referral process, we would be happy to connect you with those folks. Next slide, please, Nicolette. Now, this is the patient-facing information, and we can provide this as a slide to you as well. You can see, again, this is the flyer in the center of the page. Shows it's our one-stop shop. It shows all the information about the free quit services funded through the Department of Health, and the QR code is up at the top of the flyer. This flyer can also be made available to all of you to hand out to your patients or clients as well. And you can see here all of the contact information for the 5 program leads for our quit centers in New Jersey. So you see their phone numbers, their websites, and their email addresses for patients or clients interested in making a quit attempt. This is the information they would use. Let's say they wanted to reach out to Atlantic County, they would call 609-804-QUIT. They could email the quit center, or they could visit the website for more information as well. Next slide, please, Nicola. So here is Atlantic Prevention Resources. We have all of these graphics on the right are actually flyers. So if you tell me you're located in Atlantic County and you would like that flyer electronically, send an email to myself or Nicolette, and we can get you that flyer and connect you over to that quit center as well. So here's Atlantic, and there's their phone number and their email address, and that's their flyer. Next slide, please. Here's our Cape Assist Quit Center. So there's their flyer. They have a handy dandy QR code on their flyer now as well, which is fabulous. So they have 3 ways to enroll in their services: phone, email, and fax. And there is their flyer. Next slide, please. Here is Hackensack. They have, you can call, you can text or email for a patient to enroll in services there. Next slide, please. Here is the Inspira group. This is their flyer, and you can call or email the quit center to enroll in services there. And next slide, please. And here is Robert Wood Johnson Barnabas Health Institute for Prevention and Recovery. They have a landing page, so tobacco users can go to that website, and then they can click on some buttons to enroll in services there, and then a quit coach will call them back. They can call, or they can also email the quit center as well. And they have a referral form as well for healthcare providers. So if folks on the line are located in the counties where the Institute for Prevention and Recovery operates, please let us know if you'd like to be connected with them, and we can get you this flyer and other information about that quit center as well. Next slide, please, Nicola. We have some statewide smoking cessation groups that we want to highlight on this call today. So each individual quit center does run their own groups. They're mostly virtual right now. Anybody can join the group, doesn't matter who you are, what you are, where you are. If you want to join their group, you can. But then we do have a couple of specific statewide cessation groups that we do want to highlight. The first one here, you can see it's our virtual LGBTQ plus tobacco cessation group. This is a free group tailored to the LGBTQ plus community. Any resident of New Jersey who identifies and would like to seek help in quitting smoking and attend this group is certainly welcome to. This group meets on Monday evenings via video conference, and it's facilitated by Tiffany at the Quit Center in Inspira down in Vineland, New Jersey. And this is the flyer that they have available for that group. So if you're interested in receiving an electronic copy of this flyer, please send us an email or drop a line in the chat, and we can get you that flyer if you're interested. Next slide, please, Nicolette. We also have a youth group. This one's a bit modified. This one is a 4-week group, and it is for youth aged 16 to 18 years of age who are residents of New Jersey seeking help to quit tobacco and are usually e-cigarette use. That group meets on Monday afternoons via video call, and it's co-facilitated by Kim Burns at the Atlantic Quit Center and Marietta at the Inspira Quit Center. So if folks are interested in learning more about that youth 4-week quit group, please drop a line and we'll connect you to those facilitators as well. Next slide, please. We do have the Nicotine and Tobacco Recovery Group. That one is through the Institute for Prevention and Recovery. So we do have individuals who they have made their quit attempt. They've been successful. They've made it through the program, but they still want to meet with group. They're still feeling urges or triggers or just want to remain abstinent from their tobacco products. So this group meets on Mondays at 7 at night, and it's facilitated by one of the tobacco treatment specialists at the Quit Center at the Institute for Prevention and Recovery. And so this is important to just make sure that we want folks who have made a quit attempt, who are still new in their quit attempt, they want to move on to this group, and that's perfectly fine. We want you to stay with us so you can stay quit. That is the goal, is to remain abstinent. So if you need this group, it's here for you. Next slide, please. And we do have the Rutgers Tobacco Dependence Program at Rutgers. You can see here, this is our new flyer. We've got some new photos and new staff members. It's wonderful. So for anybody who is located in the Rutgers catchment area here in Central Jersey, here's the flyer that we use as well. You can see that they're currently offering virtual visits. And then they have 3 New Brunswick locations as well that they can see tobacco using clients to help them with their quit attempt as well. So there's the phone number and the web address as well. Next slide, please. In case we have anybody on the line who is outside of New Jersey, which is certainly possible in this virtual world we are living in, we wanted to provide some additional national resources as well. So there is that 1-800-QUIT-NOW quit line. If somebody in New Jersey calls that line, they will be redirected to the New Jersey quit line for services. Individuals can also go to cdc.gov or smokefree.gov for information about the importance of quitting smoking. There's also texting programs and there's mobile apps. And so for more information about all of this, I provide that website there as well. Please go ahead and visit that cdc.gov/tobacco website, because there are a lot of wonderful tools that you can use to promote the importance of tobacco cessation. Next slide, please. This is just one of those things that you'll see if you go to one of those websites. So there's lots of really fantastic graphics you can use maybe for your socials or for other purposes. So this is warning, quitting smoking now greatly reduces serious risks to your health. I quit is his t-shirt, which is fabulous. Next slide, please, Nicolette. Very quickly, I just want to put in a plug for what is ScreenNJ. You see that logo at the top of your screen, and you might hear myself and Nicolette talk about ScreenNJ all the time. ScreenNJ is this wonderful collaborative project of organizations across the state committed to reducing cancer incidence and mortality through effective cancer prevention and screening programs. Our initial focus was on colorectal and lung cancers, but we've branched out to other cancers and genetic counseling and some other things as well. ScreenNJ promotes the benefits of tobacco cessation. We certainly understand that tobacco use is linked to, like I said earlier, lots of different types of cancers, and it is really the most important thing somebody can do to affect the health of themselves and for their lifetimes. ScreenNJ maintains a network of community organizations across the state. So it's not just healthcare providers, it's other organizations as well, religious organizations, food banks, schools, organizations that are embedded in the community. We like to go out and give these talks to community members. And how do we do that? By finding the organizations that they go to and they learn from and that they trust. So if you know any organizations in your counties that could benefit from a talk like this one today, where we talk about quit services in New Jersey, please send myself or Nicolette a note and we can forward your request over to the Community Outreach and Engagement team at CINJ so they can give a talk like this one to the community members in your specific catchment areas. Importantly, we try to increase education and knowledge on the most up-to-date research for lung cancer screening, and tobacco mitigation. So the information you heard today is evidence-based and it's up-to-date research-based information that we want to share out to all of you. ScreenNJ does provide grants to community partners to increase lung cancer screening. And so, for example, if you're a partner out there and you might see somebody who is under or uninsured, ScreenNJ does provide grants to an organization like yourselves to cover the cost of LDCT. So if you're interested in learning more about granting opportunities, you can send myself or Nicolette a note and we connect you over to the ScreenNJ team. Their RFP for the next fiscal year should be released in the next couple of weeks. So it's quite timely if you're interested in learning about funding opportunities. Next slide, please, Nicolette. All right, so I think we're at our last Slido of the day. And so this is always fun for me. So point your phones to that QR code one more time, or you could go to the slido.com website and type in the number. We would like those out there on the line to name one reason why a patient should quit smoking. It doesn't have to be something that you heard me say today either, but one reason a patient should quit smoking. So you can point your phones to that QR code. I'm going to give it a shot here as I'm talking with you. And so my Slido is opening up on my screen, and I'm going to type in my answer. The one reason I think a patient should quit smoking. Oh, interesting. Somebody typed in it's ethical. Interesting comment. Physical appearance. Very good. So I just typed in my answer as well. Better health. Great. Saving money. Absolutely. Sure. Decrease the risk of cancer. Absolutely. Better health. You got it. Dental health. Interesting. That's a great comment. So we're going to give you all just a moment to type in your answers. We know it takes a little bit more time when you need to type in versus just answering a quick poll question. Name one reason why a patient should quit smoking. And Nicolette, I'm going to rely on you to tell me when you think that enough people have answered this question.
Sounds good, Heather. We'll give it just a little bit more time. I see 12 responses so far.
And I am just keeping my eye on the clock. I love to talk about this topic area. I feel there's so much information that I can share with all of you each and every day. And so I do want to just be mindful of your time today and leave just a few minutes time if anybody has any questions. So Nicolette, as we continue this process and we'll wrap up the Slido, we can open it for Q&A when you are ready.
All right, I'm going to move on to the next slide. Thank you, everyone. These are really wonderful reasons.
We didn't even need to have a real quiz. Y'all got it correct. So with that, I just want to thank everybody for their time today. I know it's your lunch hour and you might be munching away while you're listening. I hope you learned something. I hope we have resources available for you. I see some comments in the chat. We will certainly get flyers and other things out to all of you. So Nicolette, at this point, if there are any questions anyone has, do your thing.
Thank you so much, everyone, for your time. It's been a pleasure. If you have any additional questions, please email myself, email Heather. We will be following up with all of these materials via email to all of you. We have all of your email addresses. So thank you very much and have a great rest of your day.
Thank you, everybody.